My name is Dr. Jeffrey King. I'm a physician. I've been practicing here in the San Joaquin Valley for about 30 years now. I graduated from MIT in 1974 and from the University of Vermont College of Medicine in 1978. I did an internship in Bakersfield and have been around the valley since then. I've been practicing here in Tulare since 1994. I practice general medicine, family practice. I basically have been interested in herbal medicine for a long time and began incorporating it into my practice 10 or 12 years ago. I went to a conference back at Columbia School of Medicine in New York, a week-long conference on herbal medicine in the mid-90s, and since then began actively trying to find ways of incorporating that into my practice. I began doing medical cannabis recommendations about 6 years ago and have been continuing to do that since then. Basically, my take on the role of cannabis in medicine is that it is useful for a number of significant problems that are generally not well dealt with by conventional medicine, and that it is probably best understood in the framework of herbal medicine rather than as a conventional pharmaceutical drug.
My name is Larry Metcalf. I'm 62. I'll be 62 in April. Well, I use medical marijuana because I've got cancer, and the treatment that I'm on is a Nexivar, which is orally taken twice a day, and it has really suppressed my appetite and given me upset stomach and stuff. And the marijuana, smoking the marijuana eases the upset stomach, the queasiness, and actually makes me feel a lot better. I've also got arthritis, osteoarthritis, and that helps the pain. But, you know, you'd have to see your doctor. My doctor actually had suggested it. So I'd say, yeah, with the with the physician's statement and stuff like that, sure. Because it's definitely not for everybody. No, actually, I've got the physician's statement and I've applied for my California card, and they were pretty helpful.
The primary things that I have found it useful for are various pain syndromes, particularly what we refer to as neuropathic pain. Neuropathy generally refers to damage of one kind or another to nerves, the most common one being diabetic neuropathy. Because neuropathic pain is caused by malfunctioning nerves, it tends to have an especially irritating quality that's difficult for patients to deal with, and it often is not well controlled by conventional pain medications. Oftentimes people require large doses of opiate-type medications, which include things like codeine, Vicodin, Percocet, along with other medications that act on the nervous system in one way or another. Those kinds of combinations oftentimes have side effects that are difficult for patients to deal with, and cannabis has proven to be quite effective for neuropathic pain. I've had a considerable amount of feedback from patients that using cannabis they've been able to simplify their regimens, oftentimes reducing or even eliminating some or all of the prescription medications that they're taking, and at the same time they're able to function better. They experience less sedation, less irritability, less of a number of other side effects that are common with prescription pain medications. The primary difference, I would say, between herbal medicine and synthetic drugs is that herbs are plant-derived and therefore tend to have a number of quote-unquote active ingredients in them. They don't constitute just a single chemical. And because of that, they tend to act on the body in more complex ways that usually are better tolerated and oftentimes have fewer side effects than the corresponding pharmaceutical drugs.
Stephen Engel, born and raised Madera, California. I've traveled since then, lived in Utah for a while, a few years, been overseas, traveled around, but I'm back in Madera again. I suffer from PTSD related to my war experience in Vietnam and extreme depression. I lost part of my hip. I have a steel hip in my right side that is painful at times, especially during winter. I have severe osteoarthritis in particular joints that are very painful. And when I use medicinal marijuana, within a minute at the most, the pain has subsided substantially. In a few more minutes, it's basically gone. And it also helps uplift me from out of the depression states that I fall into at times. And there's severe depression, you know. In fact, well, I won't give my therapist's name at the VA, but they can't recommend marijuana. But off the record, he asked that this would be good to alleviate the depression. Otherwise, I'm taking about 8 medications from the VA and lots of side effects. And side effects on this one is giving me the munchies for medicinal marijuana, and that's a nice side effect to have compared to the others.
I really see quite a broad spectrum of people. Interestingly enough, when I first started doing it, I found that most of the patients coming in for recommendations were older patients, often with cancer, who were looking for a way of treating both pain that's often associated with cancer, but also the loss of appetite, nausea. And generally, older patients tend to be bigger consumers of healthcare. They have more conditions that lead to chronic pain, and so they generally need medical care at a higher level. A lot of patients with chronic pain, oftentimes from back injuries, motor vehicle accidents, this type of thing. And again, a significant number of PTSD patients. Oftentimes these were ex-military people who had had significant trauma that had left them with the whole spectrum of PTSD problems, which includes things like chronic anxiety, difficulty dealing with other people socially, flashbacks to memories of traumatic situations, but also people who had had traumatic experiences in general, severe accidents, abusive childhoods, these types of things. I should mention that one of the other very popular and very effective uses for it for many years has been treatment of migraines. Migraine headaches are quite problematic. They tend to be quite intense and disabling. And cannabis, in fact, has been considered to be a very effective treatment for many years. In fact, it's also one of the places where the smoked route of administration makes a great deal of sense, because oftentimes people suffering from migraines develop nausea and vomiting, and so they're unable to take medicine in pill form. Also, smoked or other inhaled medicines begin working more quickly, so there's quicker relief of the headache. In fact, Osler, one of the pioneers of conventional medicine in the U.S., considered cannabis to be the most effective remedy for migraines. and for many years it was very popular for that. It was also used for treatment of menstrual cramps and PMS, and in fact Queen Victoria considered it to be very helpful for that. So it has a long history of being considered to be effective even within the medical profession, and it was only fairly recently that it became illegalized and fell out of popularity with conventional medicine.
I started using medical marijuana. I have lupus and my kidneys failed back in 1991 actually, and I got a transplant in 1997. But to begin with, I was using it mostly because I was losing so much weight. I had no appetite, and in fact I was 88 pounds when I got my transplant. So if it hadn't been for that, I don't know what I would have done. But it helps with the lupus, the pain that I have in my joints. They prescribed pain medication, and I just have so many side effects with that. It didn't work for me. It's really made a difference in my life. I can sleep. I have insomnia too, so it helps with the insomnia. So I have several different reasons I use it. Yes, in fact, I was really relieved when I was able to finally visit a doctor and get a prescription and be able to come to a place like this. I'm just really glad that you guys are here. I come out here and I'm treated well, and I don't have to deal with the other elements that are out there. And you guys respect your clients and your customers. You care about us, and give good advice, and really helpful.